The Love Life and Lose Weight podcast will teach you the art and science of changing your habits around food. I'm your host, advanced certified weight and life coach, Heather Beardsley. I've helped hundreds of women just like you figure out how to stop dieting, lose weight, and love life on the journey to goal weight and beyond. Hey, welcome to episode 36. This is an interesting one. In this episode, I'm going to talk about how I've been coaching my clients and myself on semaglutide or semaglutide, tomato, which is the new class of weight loss drugs for obesity. So I want to preface the conversation with a couple of really important things. Number one, this is not medical advice. I am not a doctor. Okay. I am just a certified coach who works with weight loss clients. And this conversation is limited in scope to how I would, in essence, coach anybody on any prescription medication that they have agreed to be on with their doctor's advice. And my role is to just show them how they're thinking about what's happening with them and their medication and how that's creating feelings and actions that then ultimately result in results for themselves, right? And I do say myself because I am on semaglutide with the assistance of my own doctor and for reasons that are medically necessary for me. Okay. And it's not really an invitation for feedback about why I'm on the this class of drugs, but suffice it to say that I have a history of prediabetes. I was able to result non-alcoholic fatty liver disease as well. So I have some complications from over the past 10 years that had to do some with the way that I was eating prior. And so for the scope of this discussion, I'm going to uh, also offer some personal insights because I'm on month number 3 of titrating up with this semaglutide. Okay. And so I have my own experience of what that's been like for me, but also know that like I have my own clients who are on semaglutide for themselves. And I can tell you that everybody's experience is, of course, different, which we all know. Like everybody has their own unique physiology and experience with medication that is unique to them. And as a weight coach, I want to encourage and support my clients to reach their goals in a way that helps them, that's helpful, that doesn't throw like sort of, if I can help remove some resistance that's there in the way that they're thinking about this, I think it can be really helpful. And I think it's pretty obvious for a lot of us who have heard some of this discussion about semaglutide and such, how differently people think about it. So when one of my clients comes to me and says, my doctor is talking to me about this and we've decided to go on it, and here's how I'm thinking about it. Um, there can be a lot of stories of what they make going on this medication mean. And basically, we want to look at that story and look at the perspective of that we're bringing to being on this medication. Is it a story that makes you feel good about being on the medication, or is it one that creates fear and doubt and uncertainty? And so, like any medication, let's say it was blood pressure medication. You don't want to be taking blood pressure medication and then also judging yourself for being on it. And hopefully, this discussion has happened on the front end with the doctor before they're even on the medication. There are compelling reasons that medically, doctors obviously have been prescribing this. I've heard an obesity medicine specialist say that like it's going to revolutionize for many people who have suffered with obesity as a multifactorial like uh, disease where the medication is helping physiologically um, helps the patient manage their sense of hunger and their sense of satiety. And for, could be for many different reasons. I know for me, when I was on that HCG diet, which was 500 calories a day, and I followed that for 5 months, my hair fell out. It tanked my thyroid. My adrenals burned out. I lost my sex hormones crashed. And I lost my period. I went into premature menopause at age 41. And so when I heard this obesity medicine specialist speak on this interview he did with Katie Couric, he mentioned that there is evidence that restrictive dieters, when the body is exposed to extreme calorie restriction for long enough, for some people, it sort of breaks the signaling mechanism where these hunger hormones can operate normally. And, I don't have any scientific evidence to give you for this, but I can tell you from my own experience that after that experience with HCG, which I deeply regret, I wasn't trying to harm myself. I had no way of knowing that all of these cascade of health issues would follow this diet that I thought would just help me take off extra weight, that it would leave me with a depressed metabolism such that as soon as I stopped eating the 500 calories and I went up to like what a normal calorie count would be, that not only did I gain back all the weight that I had lost, but I gained even more because my body had slowed down so many of my processes because it thought I was starving to death. So it's going to hold on to every calorie. And it took me many years of not dieting to kind of build a metabolism that was willing to kind of ramp up again and accept eating like what's typical for somebody my size, which is, I don't know, 1,500 calories or so as like your baseline need for calories just to function. Yeah. So it breaks that chain of signaling where food in your stomach and your gut releases this hormone that travels up through your bloodstream into your brain, and tells it like, hey, we've had enough food, like we can stop the appetite signaling of hunger and we can start this sense of like satisfactory feelings that like we don't need to eat anymore. And I think for many of us, and you might agree if you have a similar history like mine, it seems that like after a long prolonged period of restriction, we just can't sort of turn off that those urges for food, those incessant thoughts of food, and maybe a feeling of like quickly becoming hungry even after you eat. Um, and like I said, I don't have like studies to show, maybe there's some out there, I don't really know. This is just me and my personal experience. And from, 10,000 hours of one-on-one coaching, it's always been a thought of mine that something happens for some of us who've been restrictive dieting that sort of stacks the weight of trying to follow hunger signals, and let that be enough and easy enough to lose weight. And for some of us, it just requires a lot of like watching what we eat and then having to override the persistent urge to keep eating, even though we know we've had enough. And being on semaglutide, for me at least, it sort of is able to turn that switch back on for me. And it's able to help me like sort of just, it just turns off that desire for more that is automatic. Now, here's the other part. The other side of the coin is You can easily think yourself into continuing to eat. So it requires discernment, whether you're on the semaglutide or not, for weight loss, that if you have a habit of overeating and thinking a lot about food, that you are, whether you're on the semaglutide or not, you're going to need to stay very aware of your thinking about food and allowing your stomach and your physical sense of satiety to lead the decision of when to stop eating. Now, semaglutide does change how often you feel hungry. In other words, like when you eat a meal on it, you will feel full for longer. So you experience less frequent hunger. Your sense of being satisfied with your meal is extended for the most part. And your sense of like fullness might come on quicker with less food. So I'm coaching a lot with my clients on adapting to changing hunger and satiety cues. But that alone will not cause you to lose weight. You're still an active player. Your conscious mind, your conscious decisions, your conscious direction of your actions and your inactions are still required for you to be involved. It's not like you inject yourself with the semaglutide and you're like a robot who's just eating less. It's just that your experience of the eating is a little bit changed in how you feel it in your body. And you may feel a dampened desire to eat more. Maybe. And here's the thing too, is the beginning of the semaglutide protocol is to titrate up pretty slowly over a period of months. And so while you're in this period of titrating up, it's just to give the body time to acclimate to this new hormone in your body that it's not used to having. And the way that they've figured it out is to just ramp up slowly. Like once a month, you get a little bit more, and each week you take that for 4 weeks. And then after 4 weeks, then you, if you're feeling good enough, then you and your doctor decide if you have more, up to an optimal dose. But truly, like, and this is the feedback I hear from a lot of my clients and their doctors, is that that point of optimal dose is really up to the patient and the doctor to decide like where they feel good. So results may not be seen right away, especially if you've been in the membership and you know about thought work. You already are engaging with your mind, right? And so being on a medication isn't necessarily going to like open the floodgates to make it completely different for you to think that you could lose weight. So in my experience with my clients, the rapid weight loss, I don't see so much of that. But then again, most of the clients that I've been coaching are not yet on the full dose. This is still a titration up period. So we're just kind of watching like how things are changing. We're watching our habits around food, and we're trying to just allow ourselves to eat a little bit less because we're reaching a physical sense of satisfaction, hopefully a little bit sooner. And so in this way, the semaglutide is, it's a tool. It's a tool that can, for some people, make weight loss be a little bit easier of a process. It's individual. It's not across the board. And there are, of course, side effects to weigh against some of these benefits that you could see. The most common side effect that I hear from my clients is like constipation and nausea and fatigue. And, you know, there are things that you can do for the constipation and the nausea, but just know that like I'm often coaching like, hey, like, okay, so you're constipated. Like there are things you can do, but just because you're constipated at this new dose, right, doesn't mean that you're always going to be constipated. The goal is for you to be able to find your optimal dose without like too many negative side effects. So instead of focusing on weight loss as my clients titrate up, what we focus on is, are they setting themselves up to feel as good as they possibly can as they accommodate to the medication? And that's really important. And so for an example of that is like feeling nauseous. Let's say my client feels nauseous and she's like, I don't know. I don't know if this is for me. And I'm like, okay, well, did the doctor give you some medication for you to take for when you feel nauseous? And a lot of times the answer is yes, but they're not taking it. And I'm coaching them on why. And sometimes it's like a thought of like, well, I'm already on this medication. I don't want to be on more. And I help them see that like, hey, like if you want to give yourself the best shot at getting to a place where this medication can really help you with your weight loss, you got to be able to help yourself be successful, which is not make it too miserable of an experience. You may not always need to be on the nausea medication, but why don't you just see if you can get through and see if you acclimate to it? And for most of my clients, it's been something that's tolerable, and especially if they're taking the medication for it. And it's the same with the constipation that I've seen with my clients. So as a coach, I would just really encourage you, if you're a coach or you're on the medication, to really think about like, this is a medication that you can think of if you're having some hard times with it and you're not quite sure how you feel about it or if it's worth it. Number one, have you found your optimal dose yet? And if you haven't, can you figure out how to support yourself to get there, and then let that optimal dose work for a few months before you decide? Okay. If one of my clients, let's say she's on metformin for type 2 diabetes, and she was wondering if it was worth it, I would give her the same advice, right? Like, let the medication work for a minimum amount of time as best you can and see if it's worth it. Use the data, journal on it. The other thing that you can do is to do a pro and con list. So where you would sort of recall what your weight loss experience was like before you were on the medication and do the pros of that and the cons of that. And then you do the same thing for on the medication now. And usually, the biggest pro to being on the medication is that it's easier to eat less in various different ways. And that there tends to be some weight loss, even if it's not ideal, it's still weight loss, tends to be more than when they're not on the medication. And then, of course, the cons can be like cost, and it can be like the uncertainty of knowing whether or not this is going to be a medication you're on for the long term, like you would consider being on blood pressure medication. And if you're okay with that, and like I would just coach them on, well, let's get to the point where you can truly see like the optimal dose and where that gets you. And then you can weigh that against how long you might want to be on it. And the truth is, you won't really know if you need to be on it until you've sort of gone through that process of deciding, like, is this for me? Are there enough benefits of being on it to warrant all of the other parts about it that, are costs to me, not just financial, but other costs? And here's the other thing that I'll leave you with, which is that when the medication is sort of changing how you're experiencing your desire for food, your thoughts around food, your urges around food, because it's changing how you experience hunger and enoughness, there is some habit change that can be playing out over the long term quietly. And I'll tell you how I've discovered this for myself. And that's I noticed that my desire for my second cup of coffee started changing. Now, I mean, I really can't emphasize what a big deal this is for me because my first job was at Dunkin' Donuts. I was 16. And that just started this love affair that I've had with caffeine and coffee my whole life. I think I've only had 2 mornings when I didn't have coffee. And those were the mornings that I had my 2 kids by a cesarean section. I was busy with other things and I wasn't thinking about coffee both of those mornings. But that's really it. I mean, honestly, since I've been 16, it's been a handful of times that I've not had my coffee. I truly love it so much. It's a deeply patterned habit of mine. Now, before I was on the semaglutide, I would always have 2 full mugs of coffee and be thinking about or considering often having more. And I'd usually have to just say, no, 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 we're not having more. That's too much caffeine. I mean, I'm talking like 2 venti Americanos, right? That's a lot of caffeine. And I always wanted more. After I was on the semaglutide for about 2 months, this happened about a month ago, I noticed I was leaving the second cup of coffee. Like I wasn't finishing it. And then it started changing more like I would go to make the second cup of coffee and I was like, I don't think I want this. Now, this is like really different thinking than I've ever had in my life. And it's nothing that I'm doing like consciously. It was never a conscious decision. Oh, I should try to like drink less coffee. It's just like this desire for it is just dampened. It's just sort of decreased. And this is autonomic. This is happening in my brain without my conscious control. It's just happening. And it's sort of delightful, I have to say, to um, experience that. And I know that if it's showing itself with the coffee, I think it's probably playing out on some level with my desire for foods. Certainly, for myself and my clients, like the types of food that we have a taste for certain meals is can change a little bit. But again, we're still on the front side of finding optimal dose. Perhaps things will change as I reach that, and we'll see also about just my own willingness to stay on it, even though it's medically, you know, I meet the criteria for needing it. We'll see. I mean, I'm happy to do, I'll do a second episode on how I've found it to be once I'm at optimal dose and if I decided to continue with it. But if you're a coach and you're coaching on this, I would just say help your client to find the results that they're looking for by really looking at the thoughts that they're having about it and doing some pros and cons to keep them attached to, what the end goal is and whether these negative things could be perhaps temporary and are they fully supporting themselves to find the benefit from the medication that, they signed up for. And, if they don't want to be on it, of course, we support that too, 100%. We're just here to support the client and their medical decision with their own medical doctor. And we're there to show them how their thinking patterns are impacting what they do or don't do and the results that they're getting. Okay. So if you have questions on semaglutide or how you're coaching on it or any questions that you have about coaching or how you might think about it, come and visit me on Instagram on episode 36 and we'll keep the conversation going over there. Okay. Stay focused. So long. Hey, if this episode was helpful, then let's connect. Visit hbeardsley.com/subscribe. That's hbeardsley.com/subscribe. You'll get a gift from me, exclusive subscriber content, and advanced notice of in-person events.